All right, everyone. Ian here with Scotch on the Rocks. And today, the long-awaited video that I've been talking about, giving an IV. So this is my friend Chris. Chris and I have worked together for the last 5 years. He's a volunteer EMT in my area, and he's worked at the local hospital here for how many months?
6 months,
About
I think.
6 months?
Yeah.
Okay. So Chris, go ahead and tell them a little bit about yourselves.
Name's Chris Pape. I've been an EMT since 2005, so I'm coming up on 20 years next January, I believe. I've just got a ton of training for medical and IV stuff.
Right on. So we're just going to hop right into it. So I bought this kit online. It was about $90. Again, not sponsored. This was just something that I got out of my own pocket. This is from sedationkit.com. If you're interested, I'll put a link down in the description. So I will hand all this to you, and we'll go for it.
So it looks like he's got a kit here. It's going to have gloves, tourniquet, tape, 2 different size IVs. It looks like just the whole setup here. I haven't dug into it yet. Everything on here will have an expiration date, which this one is 2026. You can see. Always check your expiration dates. They're very important, especially with your IV fluid. You're going to look for the expiration date on there. Check the clarity of it. You want to make sure it's not cloudy or milky looking or anything. And that's just sodium chloride is all that is, which is basically a salt water that will fuse with the blood there. They used to use lactated ringers a lot instead of sodium chloride. They kind of got away from that because allergies and stuff like that. Okay. This is more of a universal that works better with everybody.
Because that's what I used when I was in the military, was the lactated
ringers. Yeah. Basically, when you're using this, you're trying to replenish blood loss, which is very important to keep your heart going so there's no cardiac event or anything. It can be used for therapeutic reasons as well. Antibiotics, any type of medicine they give you at the hospital, that kind of stuff.
Okay. Now, is it normal if you're going to end up getting a lot of IVs over a short period of time for them to just stick one in you and keep it in?
It's not normal. It does happen on occasion, like if you have a long-term antibiotic.
Okay.
Typically, you don't want to keep them in too long because there's too much risk of infection or that kind of stuff. Okay. But I have seen it done for long, like a 2-week antibiotic where you got to come in twice a day and they don't want to keep sticking you or poking you.
Okay.
Yeah.
Cool. Very cool. So let's get into it. We can start ripping stuff apart and
take a look. Let's see what we got in this one here. All right. Like I said, there's 2 different sizes IVs in here. It's kind of like wire. The smaller the number, the bigger the needle. Okay. So you got an 18 gauge and 20 gauge, which are your most common. You get into like a big trauma situation, and you're looking like a 16 or a 14 gauge, which is a very large needle. Okay. And you can put a lot of fluid in a very short amount of time.
Right.
Of course, always have your gloves. IVs are not a sterile procedure, but you want to make it as sterile as you can.
Okay.
Because anything outside of an OR is not sterile.
Right.
Let's see. You got your Tegaderm here, which is going to be used to secure the site once you get it all cleaned up and everything attached. Actually, this is kind of neat that comes with this, so that we can lay that under the arm, because if you don't occlude the vein when you put this in, which happens to the best of us, you're going to lose some blood and everything, so it just keeps it cleaner so you're not dripping blood on your clothes or tables or anything like that.
Right.
You got your actual drip set, which is going to attach to the IV. You can see on there too, it's got a sheath on there. You're going to try to keep that and the end of the bag here as sterile as you can. Okay. Right? You don't want to be touching it and grabbing it once that's off there.
Right.
Let's see. They got your antiseptic, which alcohol prep pads work just fine, or a bottle of alcohol. And then this, just going to do some cleaning. This will help secure this so we can get it at a good angle on there. And of course, your tourniquet, which you're going to use to put on there, and it's going to make the vein more prominent. It's going to make it stand up a little better for us. Yeah. I mean, it's a decent kit.
Right on. I'm glad to hear that.
Yeah. Okay, your fluid. Is that okay if I open this one?
Yeah, absolutely. Yeah. This is all yours. All right.
So like I said, you got that on there. I don't know if you can see that on there, but the expiration is 12/2024. So it's good. The clarity of it looks perfect. Keep in mind if you're hiking or in the backwoods or anything, the temperature of these. Because if you give yourself an IV in the backwoods and these are cold, you're going to become hypothermic. It will change your body temperature.
Okay. Okay.
In ambulances, we actually keep them in little warmers that keep them just above room temperature
Okay.
to help with shock and warming and that kind
Right.
of stuff.
Right.
Yeah, that's something to think about. Yeah, if we want to get into
Yeah.
it. Okay.
Yep.
Okay. If you have any questions or anything, just let me know.
Perfect.
I'll try to be as descriptive as I can. Okay, like I said, the gloves, they're not sterile gloves, but basically it's just a barrier to protect you from me from you,
Yes.
that kind of
Yes.
stuff.
Bloodborne pathogens are,
Yes.
are very serious.
Very
serious.
serious.
Yeah.
Okay. Pull that out. So the first thing I'm going to do is we try to prep this first.
Okay.
Okay. We'll open this up. Maybe. There we go.
I got you a knife. You need it?
Got her here. So like I said, that's got a sheath on it, so I can't touch it and, make it dirty or anything like that. So it's got two different deals on here. One is going to be for if they want to do medications into the bag. If you ever heard of a banana bag,
Yes.
It's for people who are really intoxicated.
Yes.
They run it on them to kind of help sober them up. It's got
Okay.
vitamins and all that kind of stuff in it.
Okay.
So we're going to pull that. And again, I'm not going to touch any of that if I can help it. Right in there. All right. So, it's okay if we get a little bit on your table.
Yeah.
Actually, I can do it
We're,
right on
we're
here
just,
if we
we're
have
just
to.
fine.
All right. If you want to hold that real quick. Okay. You're going to prime it. Right. You got it going. Now, this also has a tip on it. And this is going to control your drip rate. So I'm off,
Okay.
but you're going to want to just do it enough just to get the air out of the lines there. And you're good to go on that. I'm just going to put that back on, just like I said, to keep it as sterile as I can.
Right.
So that is good to go. All right. Move all this stuff. Okay.
It's probably a lot easier doing it this way than it is in the back of an ambulance.
It is bouncing around and everything. So we'll do the 20 gauge because we're not doing it for any type of trauma or anything
Right.
like that or shock. Let's prep this real quick just so we have it ready. Usually, like in the back of an ambulance, you're tearing this stuff open and all that stuff. In the hospital, It's a little easier because you have time to set everything out onto a tray, so everything's right where you need it.
Right.
And if you can see that, so this one's different than what I'm used to, but it's a Tegaderm. It's going to do the same thing. It's going to hold it in place and keep stuff off of it.
Okay.
All right, so I'm going to take this real quick. I'm just going to unfold it, put it under your arm, so that way if we have any leakage or anything. Perfect.
Don't you get that on my carpet.
That's what that's for. All right. So you're going to look at, usually both arms, you try to look to see which one's more prominent because you don't want to keep poking them if you don't have to. You want to just get the most direct route. Got that one's pretty good. That might have been the one we did last time.
How can you tell?
So I can actually, his I can see. Sometimes you can't, but this one goes down right here and you can see it raised up a little bit. If you have like obese people, you will not see that. You will have to feel and poke and feel which direction it goes. Like I said, he's just way easier.
In the Army, we had a saying, fish it to find it. Is that true? Or is that something that you probably shouldn't try?
You try not to.
Okay.
Sometimes it comes to that.
Right.
You can also use they have a machine that you can put on there like an ultrasound, a mini one.
Okay.
And you can look for them, and then they have special needles that are magnetized, so you can actually watch it go in there.
Okay.
And that helps a lot too.
Probably not something I'll be doing in the field.
No. So that one right there, I think is pretty good.
Perfect.
Okay. So we're going to put that on there. We don't tie it, just make a loop in there right there, so that way when I'm done, I can just pull it and pop it off there. So now I can feel it way better, which is, that's the job of the tourniquet there, is to make it more prominent. And that one goes up that way, which is pretty good. So we're going to take the alcohol prep pad. We're just going to clean it really good. Like I said, you don't want to introduce any type of germs or anything to the body. And like I said, this is not a sterile procedure. You just want it sterile-like. Okay, let that dry for a second. If for some reason I can't see the vein or it kind of goes away and I need to poke it again and see where it's at, I'm going to re-clean it because like I said, of course the gloves are not sterile. Or a lot of nurses will actually wipe the tip of their glove with the alcohol pad to poke around, which is just fine. Okay, then you got your needle here. Of course, it's got the cap on it. There's a little chamber on here that you're going to be watching. And it's that little chamber right here, kind of by the retraction button. You're going to watch when you're doing the IV, you're going to watch for that to fill up with blood, and it's going to happen quick, and that's called flash. So that way you know you're in the vein. Okay. Like I said, like the nurses do, just so you can make sure you're on track there. Okay. You ready?
Yep.
Okay. I'm going to advance the catheter. You can see blood coming out there. Make sure to occlude it above the catheter tip. A lot of people try to occlude the catheter itself, which doesn't work. Could you pull that off for me? Yeah. Okay, we're going to attach that. Okay, so now that's in. I'm going to pop that because I don't need that anymore. We're going to do some cleanup here. Okay, how's that feel?
Just fine.
Feel all right?
Yep, just fine.
Okay, our Tegaderm. You can see on the Tegaderm, there's a place to write time on there, the date and time.
Yes.
You can put that on there. Normally, of course, in an ambulance setting, we don't.
Right.
Unless it's a tourniquet, of course.
Yes. That was the other thing that I wanted to talk about. Make sure that you make, when you put a tourniquet on.
Yes.
Make sure you mark it really well.
Yes.
Oh, that is different. That's different
That
than
is
one I've
definitely,
seen before.
I've never used one of these ones before. Okay, so that's going to be secured on there. Always make sure to take your tourniquet off.
Okay.
If you don't, you can do serious damage by leaving it on. And if you have an unconscious patient, they don't even know it's on and you're cutting circulation off on them.
Yes, okay.
So it's very important to make sure anytime you're done with an IV, you've got this in your hand and you're looking at it like it's done. Okay, then you've got that. If you have something to hang this from, tree branch, anything elevated.
Okay. You can stick it on. Is there a...
but anything. So you got that. It depends what situation you're in on what rate you're going to run this.
Okay.
A paramedic or a nurse could probably explain it a little better, but right now we have it running at nothing, right? We're closed. This is just a little roller deal. You can also clamp it off with that. Typically, we don't.
Okay.
So in an EMS setting, let's say you just need a little bit of fluid. We're just going to adjust it, so see how it's barely dripping.
Yes.
So that's called TKO, to keep open. We just want to keep the vein site open, so if we need to give meds or the hospital needs to give any meds. And you just adjust it from there. You can have it wide open, which is going to be for like your big traumas, anybody in severe shock or anything.
Right.
Or severe blood loss where you're trying to replenish.
Okay. Okay.
You'll see, so this is IV, obviously, intravenous vein.
Yes.
The other one would be IO, which intraosseous, which is bone.
Okay.
Which is where you drill into either right here or the flat part on your knee right there. And that's also instant access, and it is much simpler than this process.
Okay.
You don't want to do it to conscious people, but sometimes it has to be done.
Okay.
Mostly in like a cardiac event.
Okay.
Where the veins lay flat because there's no cardiac output.
Yes. Okay. So the heart isn't beating, so everything.
So you're looking for veins, you can't find them.
Yes.
Don't in a cardiac event, don't mess with that. Just go right to the IO if it's available.
Okay.
Obviously.
Okay.
This is good, even if you're dehydrated.
Okay.
I think, did you have COVID or the flu?
It was COVID.
COVID.
Yeah.
Which made you feel better.
Yeah,
Just
it did.
getting that fluid in and everything. So IVs are very important, even just for that reason, for therapeutic reasons.
That was why I ultimately ended up buying this, is because when I had COVID, I was like, I got the IV. It was like instant relief. The headache went away, everything like that.
It is.
So.
Yeah. And a lot of people keep them on hand just for that reason. For if somebody gets sick, you run that and you can't keep any fluids down.
Right.
You're not going to release any of this. That's going right into your system.
Right. Now, I remember you telling me when I had COVID to make sure that the flow rate is it's not that fast, because you will end up peeing it out at some point.
At some point you will.
Right.
Yes. If you ran this wide open or with a pressure bag on it, they make pressure bags kind of like a blood pressure cuff that you keep pumped up so it's pushing it in.
Okay.
You're going to need to go to the bathroom often.
Okay. So it doesn't. It's not something that stays in your system. It's just like everything else. The only thing that it does is it gets rid of the digestive system entirely.
Yes.
Okay.
Yep.
Okay.
It's just straight into the vein there, and One thing to keep, if you have a trauma or anything, to keep an eye out for is abdomen. Any abdomen rigidity or anything, because you could have internal bleeding. And if you just keep putting this into an internal bleed, you're going to do some damage.
Right.
In the field for EMS, we don't worry about that as much because we don't have huge transport times. I mean, we might be coming from the yak or something, but that's still less than an hour.
Okay.
So we're not going to do a whole lot of damage.
So then,
the long term.
When we're talking about first aid and we're talking long term, what would you consider long term? Like you're in the woods, you're in the
Yep. So let's say you give yourself an IV because you can do that. It's not hard to do. You're going to get blood because you can't occlude.
Right.
Up. If you know you're not going to be out for a long time, it's just something you got to keep an eye on for hours.
Okay.
Because if you have internal bleeding, you got to get somewhere pretty quick anyway.
Okay. So what you're saying is within a couple of hours, you need to make sure that you're calling for a helicopter or
yes.
something. Okay.
Yeah.
Okay.
Yeah, and right now, like I said, we just have a running TKO to keep open. And that'll take a while to flow into you there, but
okay. But is it so? Let me ask: with the TKO versus the fast flow rate, does the body absorb it differently, or is it just? How does that work?
It does. If you're wide open, your body's gonna try to expel it quicker.
Oh, okay, I got you. That makes sense.
Yeah.
Okay. So at this point, what we're gonna do is we're gonna take a break. This is gonna be kind of a 2-part series, so we're gonna take a break. I'm going to set up the tripod, and we're just going to have a conversation. You won't need to watch this. This will just be a verbal thing. You can watch it or listen to it in your car, kind of like a podcast sort of thing.
Oh, can I add something?
Yeah, absolutely.
Okay, so when you are done, if for some reason you're removing this, there's that catheter, the plastic catheter that's left in you, right? Because the needle came out, we retracted it back into that. When you remove the plastic catheter, you need to make sure that the tip is still on there, because those can break off and you do not want that. That's a surgical situation.
Okay.
So anytime you remove it, make sure that whole piece is there and the tip isn't missing.
Okay.
So that is something that is important.
And once if the tip does come off, there is nothing that you can do.
Yeah, you got to go to the hospital.
Okay.
Yeah.
That sounds good. But yeah, so we're going to get that. We're just going to pause the camera here for a little bit. This is going to be more of a podcast sort of thing. We're going to get the tripod set up. I thank you guys for watching. This is something that I've never seen done on YouTube before, so I'm really hoping that this is a first. I hope you guys enjoyed it, and I will see you on the next one.